Hello, viewers, and welcome to Policy Talk. I'm your host, Marian Baker, licensed vocational nurse and aspiring health administrator. This week on Policy Talk, we will explore the critical issues of maternal mortality and morbidity in the state of Texas and the best policy that benefits patients, clinicians, administrators, and other stakeholders. So let's give context to the issues of mortality and morbidity in the state of Texas. Research shows that about 80% of pregnancy-related deaths are preventable. Experts also claim that most of these preventable cases occur during the first year of childbirth. Studies also highlight that women in rural and lower income communities, as well as Black and Hispanic women, are disproportionately affected by maternal mortality and morbidity. Over the last 8 weeks, I have evaluated 3 proposed policies to address the maternal mortality and morbidity crisis. The Texas Rural AIM funding aim to reinforce maternal health safety through safety bundles for an equipped response to emergent situations. The Doula Medicaid case management pilot. This seeks to integrate culturally competent advocacy to achieve better maternal and neonatal outcomes. Lastly, I looked at the 12-month postpartum Medicaid coverage expansion. This was aimed to improve and extend access to comprehensive postpartum care. After reviewing expert arguments and using my own experience as a Texan mother and applying the Collins 2005 evaluative criteria, the 12-month postpartum Medicaid coverage expansion has my full support as our primary health policy priority. Health insurance continuity is the foundation upon which all other medical and public health interventions stand. Without access to proper health insurance, many vulnerable populations are at a disadvantage. For example, a mother in a rural community insurance coverage ends after 60 days postpartum. She cannot access any upgrades from the AIM funding, nor can she benefit from any of the services made possible by the other policies that I evaluated. The 12-month postpartum Medicaid coverage expansion extends coverage from 60 days to 12 continuous months postpartum. Enrollment is automatic, so coverage is not interrupted. The extension also provides comprehensive healthcare coverage to include mental and dental health. Maternal mortality is not just a single clinical occurrence, and more than 50% of pregnancy-related deaths may occur in the immediate delivery window and may extend up to 12 months into the postpartum period. Of the 3 policies, the postpartum Medicaid expansion is the only policy that aligns succinctly with the timeline of postpartum complications. It bridges the gap in the postpartum healthcare coverage that pushes low-income mothers into uninsurance when they are most vulnerable. Many women, especially those in vulnerable populations, become uninsured shortly after childbirth, even with ongoing health challenges and need for continued care. Medicaid coverage expansion contributes to the reduction in maternal mortality and morbidity through continuous access to appropriate treatment and preventative service during the period where the risk of death or complication is highest. The policy also fosters better managed care for chronic conditions as a result of pregnancy. As a frontline healthcare clinician, it is important to think about the best choice and its benefits to important stakeholders such as clinicians, maternal health providers, nurses, and emergency department staff. The Medicaid expansion is the best choice for many reasons. First, reactive versus proactive medicine. Right now, clinicians are forced to practice defensively versus reactive medicine even. When low-income mothers lose their Medicaid coverage after 60 days, their chronic hypertension or postpartum depression or even cardiomyopathy goes unmanaged. And these are life-threatening emergencies. The policy supports providers with management of chronic conditions. When access to preventative care is not continuous, a strain is placed on the emergency department in acute life-threatening crisis. Next, the policy supports full execution of clinical care plans by eliminating systemic barriers caused by the 60-day Medicaid cutoff. I can only imagine how defeated a clinician may feel having to discharge a high-risk patient due to coverage expiration and financial constraints. Thirdly, hospital administrators and clinical leaders benefit from the stabilization of the financial ecosystem. It replaces high-cost, inappropriate, and even uncompensated emergency room visits with reimbursable and predictable primary care appointments. This stabilization supports health administrators in investing more in quality improvement. Policy also supports early detection of postpartum complications. And with early detections comes early interventions, which leads to better health outcomes. It improves coordination of care and, of course, better opportunities for patient education. We cannot explore the Medicaid expansion policy without looking at its impact on health equity. Equity in access to care with the provision of extended care for low-income mothers. The policy also creates greater opportunities for access to follow-up and preventative care. Automatic enrollment ensures that no mother is left behind, which greatly benefits mothers in vulnerable populations. So why should we prioritize this policy? The selling point for the 12-month postpartum Medicaid coverage expansion is simple. The policy provides unmatched economic and systemic efficiency through prevention. There are fiscal benefits. The impact of health policy development on the state's budget cannot be ignored. The budget is a high priority for many legislators. However, researchers argue that untreated maternal health conditions, such as mental health disorders or unmanaged cardiovascular conditions, cost the state of Texas billions of dollars, which affects not only productivity but the state's economy. So expanding postpartum Medicaid coverage to a full year leverages pennies for preventative care instead of millions to be spent for long-term clinical failures that are as a result of lack of access to appropriate care. Research shows that continuous postpartum coverage reduces late-stage hospitalization by 17%. So like I said, the selling point is simple. Investing in continuous coverage yields clinical, fiscal, economical, and social benefits. The policy takes maternal health from an emotional debate of mothers versus the law versus administrators to a foundational economic priority that benefits each stakeholder. As we wrap up today's episode, I would like to reflect on stakeholders in the Texas healthcare system, from legislators to rural doctors, and most importantly, the mothers. It is clear that access to care is the cornerstone of the foundation needed to address maternal mortality and morbidity. While the Texas Rural AIM funding provides more efficient tools for clinicians and doula service integration amplifies the voices of mothers, neither would be made possible without postpartum Medicaid coverage expansion. The policy gives mothers the basic right to enter the clinic and seek these services in the first place. So when I think of the establishment of this policy as a priority, I envision sustainability, an equitable and highly efficient healthcare system where no mother in Texas survives childbirth only to experience life-threatening complications or even lose her life shortly after. My references are in the next slide. Thank you so much for watching, and I will see you in the next Policy Talk.